Hey everybody, it's Victoria from the Council on Aging and Social Services Departments. We're here today with Beth Ann Burns from Vitra Healthcare. She's going to talk to us today about the services that Vitra Healthcare offers, and we're going to get some just general facts, some Q&A, and hopefully a all good time. Good afternoon, Beth Ann. How are you?
I'm very well. Thank you so much. And thank you so much for this opportunity. How are you doing
Absolutely.
today?
I'm good. We're very curious to hear about Vitra Health. I have to be honest, I had not heard of you before. I don't know if there's if you're a relatively newer company, but I when you approached me, I was like, Vitra, I could not remember it off of, from my
That's
experience.
okay. That's exactly why I have the job that I have.
Oh,
So I'm the community liaison for Vitra Health. And we started this company back in about 2010. So I'm sorry, 2012. We're a little over 10 years old now. And it's based in Braintree. And they did a wonderful job of letting the market know who they are out there. And then, of course, through social media and different media avenues, more and more people were starting to know about it a little bit. So they suddenly realized that they had clients here in Central Mass and even a little bit further to the west. So they thought there must be a need for us. Let's expand. And they hired me. So they also hired my counterpart, Emma. She takes care of things on the western part of the state, the Springfield area. And Central Mass is mine. So I'm here to let you know what Vitra is and what we can do for people.
awesome. Well, we're very excited to hear about it.
Excellent. I'm going to attempt to share my screen. So I'm going to just sort of go through this, talk a little bit about it. Please jump in if you have any questions. Conversation is always much more fun than just reading slides. So Vitra Health, one of the things that we pride ourselves on is that we care for you and your community. We are a healthcare company and we want to help you stay happy and healthy and safe in your home. A lot of people are already doing this and they're doing it with the help of a loved one. Sometimes the loved one lives with them and sometimes the loved one just comes to visit every day. And we have programs that can help support that entire process. So I will start out by saying that anyone who qualifies for our program must have insurance through Mass Health. So this is any Mass Health program, the senior care options, Medicaid. And if you're wondering if you qualify, right now I know there's a lot of stuff going on with Mass Health and a lot of different insurance products. So if you are curious as to whether or not you qualify, all you have to do is call me, you can email me. All I need is your first and last name and your date of birth, and I can pop it into my computer and tell you right away if you're somebody that I can help or not. And if I can't, I'll make sure to find you a phone number for someone who can. Everyone deserves help. So the company values itself very much on all of our, on a lot of pride and on the entire premise of we just want you to be safe and healthy. So we work with, we say our clients, our partners, so on and such. Our clients are the people that need the help and the caregivers that are helping them. Our partners are people just like you, Town of Berlin, Council on Aging. I spend a great deal of time talking to people at senior centers, Council on Aging, of course, veteran centers. I even visit to food pantries. Everybody deserves help. And there's a lot of people that don't realize how much help is out there. So that's all I do is just for information. Okay. We try to really make sure that we are a trustworthy partner and very valued in our community. I want to be a part of your community. I want you to be able to recognize my logo and, happily and with pride say that's a great company, even if you're not using me. And this I can do in lots of different ways, just from relationship building with you all the way up to, if you invite me to hang out at an event, I might be persuaded to bring the snacks for bingo or something fun like that. So I get to have a lot of fun with my job and meet a lot of great people and help to let you know me and know the company so that you can trust each other and we can move on. We are incredibly reliable. I hear stories all the time of, oh, my PCA didn't come, or, oh, they're supposed to visit 3 days a week and she only shows up one. That is not us. We don't do that. If we tell you we will be there, we will be there. Life happens. If there's an emergency, if something comes up and we can't be there, we're going to call you. Never will you just be left hanging. That's incredibly disrespectful and not what we would ever do. Our story a little bit, we were started by the owner, Max. Max is wonderful. His wife is a nurse, and she started to see that was large populations of the state that weren't having access to the healthcare that they needed, or they didn't know that they could have access to the healthcare that they needed. So based on all of those concerns and two very big hearts, they started Vitra. It was started in about 2012, like I said, and it's built up wonderfully since then. So much so that they hired me, and like I said, Emma in Springfield. So, and any of us can help anyone in the state. We just try to, have faces in certain communities so that you can get to know us, like I said. And our main goal, the number one thing that we want to do is we want to keep you home and safe. This means decreasing ER visits. We don't want you to be in an unsafe situation where you end up in the hospital. So our caregivers and our case managers and our RNs, if they come into your home to check on you and they see that, there's kind of a lot going on, and sometimes maybe the mail piles up, or maybe you had to plug something in and the wires are everywhere, they're going to help you to fix those things. Those are little things that are easy for some people, but other people, bending down to put the wires away, that can be really difficult, and it can be dangerous too. So they can push it out of the way and help keep you safe. Little things make big, big differences. Okay, moving on here. These are the things that we offer. So AFC, Adult Family Care, that's the program that we're going to talk about the most today. And I'm going to describe that to you in just a minute. We do have an adult day health facility out in Brockton. That's the only one that we have, and we're not going to open another one. That one does wonderfully, but we want to be able to help a larger portion of the state. But the people that hang out in Brockton during the day have a really great time too. Our other programs, there's a lot of alphabet soup here. So FGAFC and GAFC. So these are both two different programs that break down very easily. So the family group, adult family care, quite the mouthful. Basically, that means that you have a person in your life who you have designated as your caregiver, but they do not live with you. This can be maybe your niece comes over once a day and spends an hour or so with you and just make sure that, helps you maybe prep dinner, perhaps maybe wash your hair, things like that. This is the person who helps you sort your medication, but you're perfectly capable of living on your own. So that's the family group one. Group adult foster care, and please don't worry about the name foster. It does not mean that we're going to send you to the orphanage. It's just simply what the state named the program. So that is when we would send in a home health aide. That's when you don't have somebody that you can designate as your caregiver. So we would provide one to you. At this very moment, that program is not available in Central or Western Mass, but we're working on it. And when I say we're working on it, that means that if you think that you would benefit from that and you have Mass Health as your insurance, let me know. The more people that I can say have a need and would like to be part of the Vitra family, the better. And then we can continue to hire people to come out and help. So that one's going to be happening. And of course, we are very multilingual. We have an incredibly diverse company, which everyone is very proud of. And no matter what language you choose, if great grandma just refuses to learn to speak English and wants to stick with her native tongue, I guarantee you there's somebody in the company that can speak to her and answer any questions. Everyone should be comfortable with whoever they're getting help by. So we try to make sure that happens. So let's talk a little bit about our care teams. Our care teams are wonderful. We are going to send you a registered nurse. We're going to send you a case manager. These people are very important. The registered nurses are going to be the ones that are going to help you sort out any medications. They're going to be the ones to just make sure that you're staying healthy, make sure your home is safe. They're going to be the ones that answer great questions for you. And when they come to visit you, they're going to have some questions. And it's really simple things. So, did you eat? Is everything working the way you want it to work? Are you having headaches? And they're just going to kind of keep track of those. So that can be very valuable when and if the day comes that you need to go to a doctor. You can just say, oh, yeah, let me call my registered nurse. I can tell you how long I've been having these headaches because she's going to have a record of it. The case manager is really, really important. The case manager not only is there to support you staying at home, but the case manager is there to support your caregiver. It is a very difficult job to care for another human being, and babies are way easier than grown-ups, because when we become adults, we don't want to be taken care of, but we all need care. So it's difficult to be a caregiver, and the case managers make sure that they stay a little bit sane while we're going through everything. The best example I have of this, I was on a visit with an RN and a case manager to someone's home, and their caregiver was just at her wit's end. She'd been trying for days to find out how to get her loved one a new walker. This should be something pretty simple, right? This poor woman was just getting the runaround all over. She said this to the case manager, and just like that, the case manager said, here's the phone number you need to call, ask for this person, this is what you're going to do. And the look of sheer relief on this person's face was, it very much stuck with me. It's just to make things easier and give you support. Okay. And then we also do other things along the way too. We're going to keep an eye on your mental status. We're going to keep an eye on, do you need referral to any other health services, anything like that. And we're here for you. So you're steering the ship. We're just making sure that you stay on a nice clean path. Let's see here. So again, talking more about the case management services, we can make referrals to different adult day health centers. Those are wonderful. Maybe the person that's your caregiver is wonderful with you nights and weekends, but you're kind of bored sitting at home during the day. And that's understandable. Maybe you can't do the things that you used to be able to do, but you can still go and have some fun. So we can give you some referrals to different adult day health centers. I visited one this morning that they were having the best time I've ever seen. It was fantastic. Of course, Meals on Wheels. I do know that you have a local program for Meals on Wheels, but not everybody knows that. So we can help you find that number and make sure that, to hook you up with that. Same thing with transportation services. And those, of course, are for medical appointments. We can help you apply for SNAP and different housing options. So if there's a question that you're struggling with, we are here to help. There's no need to recreate the wheel. Quite often, whatever question you are struggling with or to find the answer to, someone else has already asked and we've got the answer. So just try to make things a little bit easier for you. Continuing with case management, we continue to do referrals. We find out in the communities who are the people that are, one, going to take the insurances that you have, and two, are going to treat you with the same level of respect and dignity that we do, which is the level you deserve. So we can help you find physical therapy, occupational therapy. If you need speech therapy, maybe you need some mental wellness. All of these things are important, and each little thing does such a big difference in our lives, for positive and for negative. If we ignore all the little things, they become the big things. If we fix the little things, then our outlook is just so much better and our capabilities are so much vaster. We can do referrals to skilled nursing or to VNA. So we are a non-medical community. The same thing with any other home health agency. So if you have a wound, we would call in VNA. We would help you to register with VNA, and VNA can come and do your wound care for you. It doesn't mean that you have to get rid of us. We keep doing what we need to do for you. They come in and do their wound care, and then they exit when they're done. That being said, I'm sure some of you watching this already have a PCA or maybe your own home health care. And that's wonderful. My goal is that you're healthy, safe, and happy. However, if you would like to make a change, we like that too. And we will take care of all of the paperwork, all of the running around the minutia for you. You'll sign a release. We'll take care of everything. No pressure on that, just an option. Okay. And then we're going to do things too, like be able to help as best we can for supplies that you need. Incontinence supplies, those are expensive and sometimes hard to find. So we're going to help you with those avenues. And then I know it says education in there for disease management. Again, I don't love the words disease management, but basically what it means is we're going to help you learn how to keep yourself healthy. Sometimes it's just easier to, I'll take care of that later. Well, that's fine, but if later gets later and later and later, it can start to be a health issue. So anything from, making sure you get clear paths in the house to making sure that we help you clean out the fridge every now and again. We don't want you to eat something that, should have been tossed. So just very easy things. And then, of course, in the COVID state of the world that we've been in the last few years, and happily that we've all made it through the best that we could, we're going to help you with education on those things too. God forbid it raises its ugly head again. We're going to help you. Where can you find PPE? Where can you make sure that you've got hand sanitizer everywhere? We're going to remind you to wash your hands, something we've all been learned since we were little kids, but it came in awfully handy to keep being reminded of that during COVID. So it's the little things that we tend to let slip. So let's talk about the AFC program. This is my favorite program that we promote. This is the adult family care. So with this program, you have someone in your life already, a loved one, a family member, a friend, and this person is taking care of you and you live with them. Okay, so you must live together, and this person's job is to take care of you. So my job is to make sure that you and that person get some extra support. Okay, so if by taking care of you, it means that this person reminds you to eat lunch, reminds you that, it's time to take a shower, things like that, or maybe they help you set up your medications. Maybe it's really difficult for you to get into the restroom, so they help you with that. All these little things, they're called ADLs. ADL stands for activities of daily living. Things that we don't really think about because we just do them, but at a certain point in our lives, they become difficult to do. So if you have somebody who's helping you with those things, I can make it that we can help you both. So as long as you have, like I said, Mass Health or some of the senior care options for your insurance, then in the AFC program, we would send you an RN, we would send you that case manager, and the person who's your caregiver would receive a stipend. They'd be paid for taking care of you. We have 2 levels of that, level 1 and level 2. Of course, our nurses would sit down with you and do an assessment to determine which level you are. And one of the really nice things about the stipend is it's pre-tax. There's no taxes involved in it in all. And one of the things that separates Vitra from some other companies that also promote the AFC program are that we have 3 ways that you can be paid. You can be paid by direct deposit right into your bank account. You can be paid by a paper check, good old-fashioned way. And you can also be paid by a debit card that they would just recharge on a biweekly basis. The debit card's a really great option for people that don't have a bank account. Not everyone has a bank account. Not everyone has the means, the need, the documentation to get a bank account. That's okay. If you are helping someone, we're going to help you. Okay. So this is my absolute favorite program that we promote. It helps so many people because you just get the extra support. You get the extra set of eyes and ears and the extra knowledge and then some extra money in your pockets. None of that is a bad thing. Okay. This is basically what I had just said. These are the things that make Vitra a little bit different from some other AFCs and different from PCAs. We also make sure that that we're training the caregiver. You're not going to be a caregiver one day at home and then suddenly you're a CNA. We don't certify anybody, but we teach you how to properly care for someone. And we teach you, very importantly, when to call for help. So many of us have heard stories. I'm sure every single person on here knows someone or knows of someone that had a fall. You trip, you fall over the carpet. I fall all the time, or I trip all the time, I should say. And somebody, family member goes to help you up, and now you're both on the ground, and now you're both hurt. Picking someone up is something that you have to be trained to do, especially another adult. It's easy to pick up a child. Pick up another adult, you've got to know how to do it the right way so that neither of you get hurt. If you don't think you can, you need to call for help. So we just help you reiterate these different things. Helping another adult in the restroom is a difficult thing. We're going to train you on how to do that so that both of you are comfortable. Okay. We're going to make sure that you're doing what you need to do to maintain Mass Health. Right now, one of the biggest conversations all of our case managers are having is that Mass Health is doing their recertification. They're going through a whole pile of people. I've heard it dates all the way back to 2018. I'm hoping for them that that's not true, because that's a lot of people. So they're recertifying everybody. The good thing about that is that they're changing a lot of the limitations, the income verifications, and all of these things, which means that more people are going to qualify. Even if you didn't qualify recently, you'll have a better chance of qualifying very soon. So keep your eyes out for that. And of course, if you need to know how to go about finding out if you can qualify for any of those things, I'm sure that you can ask Victoria, and you're always welcome to call me, and we'll take care of that. Okay. Again, we can do the debit card. This is a wonderful thing. It's easy. It's in your pocket. You can use it anywhere. And it is tax-free, which is great. That means if your caregiver is also somebody who's receiving benefits for something else in their life, helping you and for them getting paid for helping you isn't going to interrupt any benefits that they're getting. We don't want to disrupt life. We want to make life easier. The next one, the FGAFC, remember that alphabet soup we talked about in the beginning? This one is family. This means that you are perfectly capable of living on your own, but like I said, maybe your niece comes over once a day and kind of checks on you, helps you out with a few things. So we can, again, provide the same services. We can still provide the RN, we can still provide the case manager, and we can still provide a stipend. Okay, at this point, it is a taxable stipend because you'd be getting a 1099. Essentially, your loved one would hire you, is how that works. Okay, but still, the extra support is there for your health and your safety, and a little bit of extra cash in your life. If you are somebody who is a caretaker, if you are somebody who has a caretaker, if you know of somebody who might need any of these services, and that can be any of us, all you do is call. Give me a call your Council on Aging. I'm going to make sure that my phone number is everywhere so that you see it, and you'll see me out and about in the community. I try to be out and about as much as I can. Of course, making sure to keep everyone safe, small groups. Like I said, I'm willing to bring snacks if you invite me to a fun thing. The more we get to know each other, the better, and the more comfortable you'll feel telling your friends and family about my services. Okay. So that is Vitra in a nutshell. And I know that I talk an awful lot and rather fast. So what do we have for questions?
Oh, Bethy, and thank you so much. This was really informative. And, I, like you said, for a company that's about 10 years old, you guys have done quite a lot already. So quite
Very sad.
The couple of questions that I could think of, just again, knowing our population,
Mhm.
if, do you guys currently have any kind of wait lists or any kind of backlogs in terms of services ending? I mean, services either starting or, getting people in the door.
At the moment, the only sort of speed bump that we have is providing the actual home health aides. So that's the program where we would provide you the caregiver. And that's why I said, if that's something that you think you'd be interested in, something that you think your members would be interested in, keep track and kind of let me know. And, every now and again, let's check in with each other, and you can just say, yeah, I talked with 3 people this month that, that would find that beneficial. The more I can prove to my company that if they hire more people, we can keep those people busy, the more people we can get out here to help, which is why right now I can offer the AFC program and the FGAFC program. Both of those programs, you already have your own caregiver who's a family or friend. And then hopefully very soon I'll be able to tell you that I can also supply caregivers to you.
Gotcha. If somebody doesn't have Mass Health Standard, but maybe has another one of the Mass Healths, is there a way that your agency would be able to help somebody to see maybe if they get redetermined, or is it something that again would just fall solely with the council? Either's fine, but I just was curious.
No, it's a really great question actually. So Mass Health Standard, Mass Health Commonwealth, any of those things are, no questions, you're in. I've talked with a few people who have Mass Health Limited. So that one, people a lot of the times get, not all companies can help if you have Mass Health Limited. I can. So we just sort of take a little side route for a minute. We have partners over at Fallon and Summit Fallon in Summit, sorry. And what I do is I can call over to them with your information. They're going to talk with you. They're going to work with you about getting redetermined, and seeing if you can get to a different status. And then, of course, if you can, that's wonderful for you. It opens up more doors for you. And of course, it opens the door back up to me, and we continue on our journey together.
Is there any senior care option program that you guys don't accept?
Not to the best of my knowledge.
Okay.
I'm hoping that that's the truth, but not to the best of my knowledge.
We know sometimes that, now with all these different companies offering these senior care programs, we occasionally will get a call being like, I have Blue Cross and I don't know if my provider takes Blue Cross, or
Yeah,
it can be a challenge. So
it can. It's really easy for me to look up your eligibility. Again, people can call you, people can call me. I just need the correct spelling of a first and last name. The system is not forgiving. If there's two T's and I write one, you don't show up. So correct spelling of first and last name and your date of birth. And I can look into my system and tell you in a matter of minutes if you are eligible or not.
if anybody wanted to get more information, like, do you guys have a local office nearby, or is it a lot of the information just solely going to be online?
In this area, it's solely online, and then me. So I am happy to come to the senior center. I'm happy to meet somebody in their home. I'm happy to meet you at Dunkin' Donuts. Wherever you're comfortable is where I'll go. And of course, you can always call me direct.
So, well, I think, Bethany, you've answered all the questions that we've had at this point.
Yeah.
If you want, what we can do is make sure that we get your best contact information, the phone, email, everything like that. We'll make sure we blast it on our side as well, just to make
Thank
sure that
you.
all the residents have access to it.
Please.
And like I said, I think, I think that you're right. Vitra is picking up a lot of what the shortcomings are for a lot of the services. And I'm sure, as you know, as well, post-COVID, we're living in a very different world, and that healthcare is very different than it was, pre-pandemic. So, and I know a lot of people, I think, are just very, they want, like you said, they want to be able to stay at home and stay safe, but sometimes we don't always have all the avenues, or sometimes there's different restrictions, there's waiting lists or things like that. So I think that the fact that, again, Vitra's, one more name out there that, we can use, and one more resource that, can service our area is just wonderful.
Maybe I'm not the right fit for someone. Maybe they don't, aren't eligible for me, but somebody else is. So I can help you find somebody else too. Everybody deserves proper health care. So we can just help you with that. And I always tell people, if you qualify for these programs, you're already doing what you need to do to qualify. You just don't know that the program's there. So now you know. Exactly.
Well, Beth Ann, thank you so much for your time. And everybody, we hope that you found this information very helpful. And, we will gladly have Beth Ann back, hopefully in person in the fall. So
I'd love that.
Keep you posted. Thank you, Beth Ann.
Thank you.